Okay. All right. Okay. Well, thank you so much, everyone, for joining today. This is really our first kind of open, broader network sharing implementation community session. And we're so fortunate to be joined by our fantastic panelists today, who I will let them introduce themselves before we get into it today. But the title of today's session is A Perfect Pairing: Engagement Science and Implementation Science. And like I said, this is our first session, really kicking off this implementation community that we're building and sharing and forming across the Kids Brain Health Network. All right, so my name is Vanessa, and I have the privilege of being the facilitator for our Kids Brain Health Network community, as well as getting to really kind of shape what this looks like with incredible KBHN colleagues like Corey, and then our amazing KBHN community of practice, which I'll share a little bit more about as well too. Um, so I am a settler on these lands and an uninvited guest. I have Portuguese roots. I am the daughter of immigrant parents who came to the country we now call Canada in their teenage years from Portugal. As part of my role as well, I'm also a postdoctoral researcher working at McMaster University and Canchild Center for Childhood Onset Disability Research. McMaster and Canchild are located in the city we now call Hamilton, which is the traditional territories of the Mississauga and Haudenosaunee nations. And I'm very grateful to be able to work, grow, connect, play, learn on this land. This is also protected under the Dish with One Spoon Wampum Agreement. And I was reading a book recently titled The Serviceberry, and it talked a little bit more about what this agreement really means. And it framed it as an agreement for sharing with a joint responsibility for care. Uh, and it made me think a lot about, our current social political climate, and thinking about, taking what we need for ourselves, but also ensuring we're not taking more than that, and leaving enough and supporting others within our society, and not causing unintentional harm to our lands and our society in broader context. So yeah, it had me reflecting a lot. It's a beautiful book I can share in the chat after if anybody is interested in learning more. As KBHN is also a national network in scope and in reach, we also want to give gratitude to the many lands and acknowledge the traditional territories our network and colleagues work and connect. So if you're comfortable as part of your introduction in the chat today, please feel free to share about where you're joining from, if you know that, if you're comfortable sharing that, and any other reflections that you'd like to share about what that means to you as we think about reconciliation. So as I said, this is the first session, and I'm just going to add these people who are in the waiting room. Sorry, give me one moment. There we go. Our first implementation community session. And our community now, it kind of has two components. One of those being a smaller community that we call our kind of community chats that are KBHN affiliated project staff, researchers, family members, implementation support specialists, and we come together to chat, share resources, ask questions related to numerous different implementation topics. As part of this broader community and initiative, we're also launching these network opportunities and open sessions. We're still working on the naming, would take any ideas and feedback. And with these sessions, opening it up to the broader network in KBHN and beyond. And the focus of these sessions are really to support and build capacity amongst KBHN community members in implementation science and practice, but again, also beyond that. So sharing within KBHN, beyond KBHN, and having that opportunity to really bridge connections together, share and learn in the field of implementation science. These sessions are really focused on discussing and learning about implementation topics, but we're really interested in delving into some topics that might be deemed a little bit more complex, some that are more particularly topical or relevant to KBHN initiatives. And with today, of course, engagement is core and foundational to everything that KBHN does and part of all of their projects. So we thought that this would be a perfect session to kind of kick us off to really think about that intersection between engagement science and implementation science. And then, of course, our broad overall goal, ambitious goal that we know we will work towards is really about advancing implementation science in the field of neurodevelopmental disability through this broader implementation community and its components. So the objectives of today's session are to discuss the synergy between engagement science and implementation science, explore engagement strategies in child health and development implementation initiatives, and to identify next steps to strengthen engagement in implementation science. And so through our panelists and our awesome discussion that we have, we hope to work through and address these key objectives. During the session, just a few quick housekeeping. I talked about the cameras already. If you're comfortable keeping your camera on, we always love to see you, but also acknowledge that there's lots going on. So if you need to keep it off, that's also okay. To keep yourself muted throughout our discussion, unless you have a question, a comment that you'd like to share with our panelists, or during our question and answer period at the end. Please also write any questions, thoughts in the chat, as I see people are doing now as well. We can also have an opportunity, if our panelists are open to it, if people want to shout out questions, or we can refer to questions in the chat as they come through our discussion. But we'll also have some question and answer at the end. We're going to be discussing 3 key questions today. Of course, I know there will be many other questions and topics kind of that come out of this and are embedded within this, but these are the ones we brainstormed to really ground today's session and lead some discussion. So how have you incorporated engagement strategies or science and implementation initiatives? Looking at the similarities and differences between engagement science and implementation science. And then reflecting on what you're curious about in these fields and some next steps to advance our work and efforts in both engagement and implementation. And I'll put these questions back in the chat so people can see them as we move through them throughout our discussion. All right, I'll stop talking now and I'll pass it over to our wonderful panelists who will introduce themselves, share some key definitions before we get started, and then I'll stop sharing so that we can all see each other. All right. Is it okay if I start with you, Sara? Sara Pot?
We've got bookends here with the 2 Sarahs.
Yeah.
Well, it's great to see so many names and faces on the call. And I can appreciate too, if you're not able to show your video, that we're just so grateful that you're a part of the conversation, especially as we see in the chat and the occasional emojis that pop up. So it's just, it's an honor to be a part of the conversation. Recognizing too, as I read through the chat with all the intros, that we're coming from so many different spaces and places, but obviously all of us passionate about the work of engagement, which I believe is foundational for community. And I just think, stronger together, right? We don't have competing initiatives, but we are coming together as a collective in this conversation. And so I'm joining the conversation wearing a couple of hats, as we often say, that language around roles or perspectives. Primarily, I'm coming in as a parent of 4, with 1 in Toronto and 1 in New Zealand, and my younger 2 at home who live with a very rare diagnosis, one of 3 families in the world. And my story in terms of understanding them, who both Rachel and Yannicka, who are now 19 and 16, that whole experience of raising and caring for my children who were so unfamiliar to me right from birth has really propelled my interest in the world of engagement and implementation science. So I'm also coming in with some background now in implementation science, having followed through on some training through the Center for Implementation, and do a lot of work around family engagement and facilitation with CanChild's Family Engagement and Research Program and Rare Kids Can, which is one of Canada's newest pediatric rare disease clinical trials network. I'm joining the call from just down the road from McMaster University, as that was referenced a bit earlier, and far, far from KBHN. I think KBHN is on the other side of this part of Turtle Island, but I'm in the Niagara region, also known as the traditional territory of the Haudenosaunee and Anishinaabe peoples, part of the Between the Lakes, the Land Between the Lakes Treaty. Really excited to be a part of the conversation today. And Vanessa, I really appreciated the way you introduced yourself and referenced also a book that you has really impacted your work. And so I'm actually hoping a lot of us will share things that have impacted our work, whether it's a good book or a good podcast. Looking forward to learning from all of you.
I guess I'll go next. We'll go in order of the slide screen there. Hi, everyone. It's so nice to see so many familiar names and faces and also some new ones. My name is Andrea Cross, and I'm calling from Hamilton, Ontario as well at McMaster University, where I'm an assistant professor in the Department of Pediatric and scientist at CanChild. But one of my main hats is I'm a mom of two young children who are 5 and almost 4. I can't believe it. And are really the center of my world, and also led me to a passion for child health as well. I We'll be talking a little bit more about my journey in terms of engagement implementation science, but I learned first about this in when I started my PhD at CanChild over a decade ago now. And when I came to McMaster, I'd never heard those two terms, but I had been teaching swimming lessons to lots of children and working in children's treatment centers, and knew I wanted to do research that was done with families and healthcare providers and that would make its way to families and healthcare providers. And so when I learned about this terminology, I was hooked right away and have been actively learning as much as I can over these last few years in this field. And so very excited to have this conversation today. I'll turn it over to you, Ray.
Thanks, Andrea. It is lovely to be here today. I'm calling in from sunny Calgary, Alberta, which is also Treaty 7 territory and Métis Districts 5 and 6. I come here today as a knowledge broker, and some of you might not be familiar with that type of a term. The short version is I'm a bit of a bridge builder, both between researchers and people with lived experience, as someone with lived experience of being a parent myself of a child who was born with a very rare chromosome condition and who had an intellectual disability. I also am a disabled person myself, and so to bridge conversations between the academic world and the research world and people with lived experience who can be such an impactful partner within the work of furthering research has been a very passionate topic of mine in terms of how I can not only communicate new information that families might not necessarily have had opportunity to be privy to previously, but also to consider what design looks like and implementation looks like in terms of coexisting as long-term ecosystems of partnership. So I'm very much looking forward to chatting here today.
Great. Thanks, Ray. Thanks, Sarah. Thanks, Andrea. As you all have said, just delighted to be on this panel today with you all and have this conversation with this group. I'm also Sarah, so the other end of the bookend, and I'm an implementation scientist at Holland Bloorview Kids Rehabilitation Hospital. It's a newer role from me. I was previously at Toronto Rehab, so I've been at Holland Bloorview since July, and my background is in health services research and knowledge translation. So, in my PhD days, I was doing, partnership work. I worked during my PhD, so have long done, integrated what we've called, integrated knowledge translation, consistent with my background. And as I have advanced in my career, I have been, really interested in what does that mean exactly? What does, integrated knowledge translation mean? Does patient engagement mean, and what does it mean to do it meaningfully? So really, interested in that space, being specific about our processes and processes that lead to good outcomes. Um, so again, just delighted to be part of the conversation, and look forward to the feedback, and for the group as a whole to participate as well. So I think we, in recognition that there may be, sort of various levels of familiarity, with implementation science, with engagement science, we thought we would kick off the talk just with some, you know, definitions. So as sort of as a place to start. So this will be very brief. It just sort of sets the stage. So formally, implementation science is the scientific study of methods to promote the systematic and comprehensive uptake of research findings and other evidence-based practices into routine practice, really with the overall goal of improving the quality and effectiveness of health services, and really overall population health. It is distinct, but does share some characteristics with quality improvement. And it uses models, theories, and frameworks, and the involvement of transdisciplinary research teams, including the voices of people with lived experience. Although sometimes those models, theories, and frameworks that we commonly use, that lived experience piece, is not as emphasized as much as it could be. Next slide, please. So just in reference to those models, theories, and frameworks, Per Nielsen, actually in 2015, had a seminal paper categorizing the different types of models, theories, and frameworks. So just as a brief review, so there are process models, there's determinant models, and there are frameworks that we use to evaluate implementation. So just to give you a sense of, all of these different, frameworks that we use in implementation science, Per Nielsen, had classified them into these three buckets. So the process models, they describe the process of translating research into practice. The determinant frameworks, those are the frameworks we often use when we're wanting to capture barriers and facilitators. And then some frameworks that we use to, as I was mentioning, evaluate implementation. Next slide, please. So patient engagement in research, it refers to a spectrum of research that is co-produced with patients, often patients, but of course it can be other members of the public, and through a wide range of activities in which patients or other relevant knowledge users have varying degrees of influence on decision making. And I suspect, wide range of activities and influence on decision making will be part of the discussion today. And patients and other members of the public who are engaged in this co-production are commonly referred to as patient partners, but certainly that that term can yield some associated discussion. And then finally, we thought that we'd include a definition of engagement science, and this is really about examining the methods and outcomes of engagement to build an evidence base for the value and quality of engagement. So we're, as part of engagement science, we're really interested in looking at the methods, the processes, and approaches that yield good outcomes, right? So that's it in terms of the definitions. We didn't want to throw many more at you, as I say, just to establish, just to provide some a foundation. And I think with that, we're gonna launch into our discussion.
Absolutely. Yes. And thank you so much for those fantastic introductions. We're very thankful to have all of you here with your vast and diverse experiences, knowledge, to be able to have and engage in this awesome discussion today. And thank you for some of those foundational definitions. We hope that was helpful for people. We're acknowledging people are coming from different places in their knowledge. All right, so our first question, and I'll put this in the chat here as well, is how have you incorporated engagement strategies or science in your implementation initiatives? And I can call on someone or see whoever would like to kick us off here. I see Andrea's unmuting, so perhaps, yeah.
I can kick us off and then others can follow. So when I was reflecting on this question, one of the examples that I first thought about was some of what started in my PhD with CanChild's F Words for Child Development research program. For those on the call that may have not heard of the F words, I'll just preface with what they are so we know we're all speaking about the same F words here, which are functioning, fitness, fun, friends, family, and future. And I started in 2012, and this is when a paper that was written by Dr. Peter Rosenbaum and Dr. Jan-Willem Horter was published called The F Words in Childhood Disability. I swear this is how we should think. And the framework is an evidence-based framework, and it's based on the World Health Organization International Classification of Functioning Disability and Health, or the ICF framework for short. And they had published this paper to try and bring attention to the importance of taking a strengths-based, family-centered, and holistic approach to child health and development. And when I read this paper, it just spoke to me. Again, I'm thinking about my time as a swim instructor and working with children, and that was exactly that. I saw the benefits of the water in so many holistic ways and knew that if it stated as a publication, we weren't going to reach families and service providers who could really put this framework into action. So this was my first introduction to there was this paper, there was this framework, but how do we move it? And at McMaster, there's a knowledge translation course that we take as part of our master's course. And so when I started to learn about knowledge translation and implementation science, it just became this perfect synergy between the two of them. And so for that project, knowing that we wanted to get to families, we partnered. I wasn't a parent at the time, and we needed to work with families to see how would be the best way, first of all, to families like this framework, and then what would be the best way to share this framework with others. And so originally, we partnered with 3 family partners who had all heard about the F words in different ways and were showing interest in it, and developed this integrated research team. And so that was the beginning of my personal journey in terms of learning about both engagement and implementation science. And reflecting on this question, while we did absolutely combine engagement strategies, and engagement was at the core of that project, we were doing an integrated knowledge translation or an implementation science project. So we were very much studying that we were not studying our engagement strategies. So we were not doing engagement science at the time. And at CanChild, they had been engaging families and children for decades prior to this on different projects. But similarly, we're not studying what they were doing. It was just part of what they were doing. Through that journey, we learned a lot about engagement through working together and recognized that we needed more training in engagement. And both families and researchers were looking to, for that education and not really finding a lot at the time. And so that was the beginning stage of the Family Engagement and Research Program, which was the partnership between CanChild and Kids Brain Health Network. And so we're talking like a decade ago now. And I was thinking, okay, what's happened? The F Words program is still very much vibrant and moving, and we're engaging with a lot more families and service providers. We've really advanced our knowledge in terms of implementation science and done multiple implementation projects. Engagement is at the core of everything that we've done. But have we advanced engagement science? And it wasn't until a very, very recent study where we partnered with 4 organizations that we decided to also study the engagement in what we were doing. And so we would have check-ins, so informal check-ins, but we also did the patient and public evaluation tool at different phases in our implementation project to evaluate our engagement. And right now we're co-writing a paper on the process of engagement in that implementation study, as well as the evaluation. And so I'm now seeing this synergy and the importance of doing this, but also reflecting on some of the challenges as well. And so they're equally important to do, and I think we can do a better job of doing it. But again, I find that, we're all projects are, we only have a certain amount of funding and capacity. And if we're applying to, say, a CIHR, Canadian Institute of Health Research grant, and we say we want to evaluate our engagement strategy as well, it's in there, but then when our funding gets caught, it's usually the first thing that goes. We actually evaluate the impact of the intervention or what we're doing before we evaluate the engagement. So that was something that when I was thinking about this, that I really reflected on. Not that I have an answer to overcome that challenge, but there's absolutely an opportunity to merge these fields better, but there's barriers, and how can we use implementation science knowledge to guide us in overcoming those challenges and barriers? Who wants to go next?
I'm unmuted, so I can go next, and it's very tempting, Andrea, to reflect on what you've on what you've presented, right? So I'll try and sort of keep to the plan, and then I know we've got time to reflect on each other's great experiences. So my reflection when I was thinking about this particular question was, I think back to when I started my first grant as an independent investigator, and as I had done before, consistent with my training, we had partnered with a community organization. We were evaluating a peer support program for individuals with brain injury. So we said we're using an integrated knowledge translation approach. Our partner in this case was the community organization. And so this was in 2018. And, at that time, what I had been familiar with was, reading, other papers, where, the paper said, we've adopted this integrated knowledge translation approach, or IKT approach. And then, there were not a lot of other details about what that looked like. or what were the outputs of that? And so one of the things that I thought would be, meaningful and helpful to do would be to document, how the important input from our community partner had changed our protocol. So some things. So we sort of did a study within a study, and did map out, or document the changes that came from the input. And so I thought that was, you know, I hadn't seen that sort of regularly done in the literature at that time, despite, previous experience with partnering with people with lived experience or a community organization. So I thought it would be a meaningful contribution to the literature. And the feedback, of course, was very helpful. Not, I'll be honest, not um, al- did deviate from our protocol, although our community partner, had reviewed and provided input on our protocol, as we were submitting the application. So as an example, this was a pilot feasibility RCT, and one thing that we thought that we would do would be to look at the impact of dose, right? So if you got, peer support twice a week, versus, once a week, was there a greater impact? And as we got the funding, and doing this evaluation, and implementing the program became a reality. The feedback that we received was that, in fact, especially for this population, that having twice a week phone calls was just too much of a burden. So it impacted our protocol, you know, really importantly. We also changed our primary outcome measure as a result of that. Feedback. We got important feedback around, um, recruitment information. So I think, all to say, it was a really, I think, a really helpful experience for both our community partner and the research team, to document those changes, and to show, explicitly how the feedback, had been incorporated. So I think that was a really, I mentioned that particular study because it was, for me, a real turning point in terms of being interested in being explicit about, the approaches that we're using when we're doing engagement in research, and documenting those approaches, and then thinking about, how might those approaches impact overall outcomes. I'll leave it there and pass it over.
Thanks so much, Sarah. In thinking about my answer here, I got thinking about a conversation I was having with a nurse yesterday, how my family's our joking crest about like things that have happened in our lives has been, the Martens family. Okay, so we're doing this now, is kind of this whole thing of just being open to the idea that life can shift in moments, and you just need to go with the flow in however things happen, and then you just you listen, and adapt accordingly, and you mobilize. And I've realized how much that has seeped into my conversation with what we're talking about here in various ways as well too, because for a little bit of context, because I realized I didn't really give much of an introduction to start out with, is I split my time between the Family Engagement and Research Training Program, but also with the Israeli Accelerator through the University of Calgary, which examines research in various disciplines from a neurodevelopmental disability lens and across the lifespan. And in my work with the latter, right now we are transitioning towards the idea of developing an ecosystem of collaboration in ways that offer opportunity for people with lived experience to find ways where and places where they can embed themselves, but also participate in ways to receive some of these research outputs and things like that. And so there's a need to think about how we effectively coexist with one another in that case. And so when I think about some of that aspects of kind of implementing such a strategy, there is a need to not only introduce people with lived experience and community members to the idea that this is a new part of your life now. This is something that you can do, and this is kind of where to go and how to guide through that process. You have to also transition people who have been used to the world, the research world existing a certain way, and thinking about why it matters to kind of consider these transitions. And so within that, some of the strategies that I've used within engagement in this case have been things like creating safe spaces for dialogue, not only during the planning and things like that, but also during sessions, things like that, where there's opportunities for public conversation, is understanding that it's not about transitioning people and saying, hey, I'm over here, you need to be here right now. It's more about, I took this journey to get from here to here, and walking people through that deserves the time and the patience in order to do so. In that case. So, but then also as well, considering relationship-centered approaches as well too, because understanding the notion of we've always done things this way comes with a lot of backstory in some cases. And to transition someone to new thoughts and new philosophies in that case is really about understanding their story as well too, and helping them consider another side to that as well. But then also thinking about how I can adapt with feedback and offering opportunities, even on an informal level, to consider. And I have somebody at my door, but I'm going to finish my point here at the same time. But also supporting the capacity of people around me as well too, to help build their skill set and make sure that we have opportunity to make sure that new leaders can emerge from this as well too.
That was really quickly at the end there. It's interesting listening to all of you speak, because I think all of you said the word feedback in your sharing, and I think that's a really interesting word to bring into this conversation around what otherwise feels like some big words like implementation science, engagement science. When we talk about these things, we can get sometimes lost in the language. And it's interesting that you all reference the word feedback, because it makes me think of a particular podcast that I heard earlier this week. I'll pop it in the chat, but it was about how language changes, and how when language changes, it generally changes what they say from the bottom up, is what the grassroots, what the larger population wants to see happen. That impacts then our language and what gets inserted in the dictionary. And I promise there's a connection to our current topic, because we could have called this the PB&J session, the peanut butter and jelly session. Well, we chose the language of perfect pairing because we do see this intersection between engagement science and implementation science, in that this is not just about looking at strategies and frameworks, but it's also looking at how we hold ourselves accountable to the work we're doing. And that not only is it about how to do something, it's how to do it well. And then who do we have to remember to include? And that piece around feedback really, it's just this consistent reminder of who needs to be a part of this conversation in bringing whatever it is we're doing to life. And I say this thinking, because I went down a rabbit trail the last few weeks and thinking about the start of implementation science. And I'm not sure how many of you went down this same rabbit trail around the relationship between sailors and scurvy, and the maternal deaths. And oh my goodness, you're going to need to do this some night instead of, well, I know some of us are hockey fans, so perhaps we're keen on hockey, but look up the sailors and scurvy story and at the heart of implementation science. But I'm actually going to point out another doctor by the name of Dr. Gnaz Semmelweis. And he, in his late 40s, actually succumbed to mental health challenges because nobody was listening to his wisdom around reducing maternal deaths. He was seeing doctors perform autopsies and then move over to work on mothers who had just given birth. And then there was this germ factory happening. And this dear doctor, so this is not to now I've totally discouraged you as well in your work around implementation science. No, I haven't. I want to say that there's something pretty amazing at the heart of this intersection between engagement in science and implementation science, and that is the intersection of bringing in that wisdom that's learned and the wisdom that is gained through experience. And then what does that look like when we're trying to do better for all of us? What are we doing in terms of creating a community that will flourish? My experience in implementation science really does feel like bottom up. I was in the world of taking care of my kids and trying to figure out how to care for them. And I was picking at what I could learn from other individuals. I didn't go into university thinking I would study implementation science. I did go in to study education, facilitation, and engagement, and then happened to come across this work around implementation science and realized this was the piece that I was actually really curious about. I just didn't know it had that name, implementation science. And what I have found in one of my recent experiences is that there's still that unfamiliarity out there. I mean, patient engagement is a buzzword. I just got something in my inbox this morning. Want to learn more about patient engagement? I mean, goodness, it's everywhere. What does it really mean? What do we mean with those words? Like the words can distract us and the words can also empower us. And so, I will just share quickly one experience for me around the work of engagement strategies and implementation sciences. I had someone reach out to me last year at this time, and they were newly assigned to an organization, and they were asked to create a patient engagement framework. And they were handed the IAP2 framework, and they were told, here, this is the framework. Now, could you create something for our organization? And I just put it in the chat. And if you look at it, this is the updated version. It's lovely and it's helpful, but if you have no education, training, experience around how to bring something like this to life, it's a little overwhelming. And so I've had the honor to walk alongside this individual and to talk about the elements of implementation science in terms of what's our first thing we do, looking at that IAP2 and appreciating it, but thinking about let's peel back the layers, and then using engagement science to ask some of those hard questions about who are you including in this conversation. The organization was having one individual create a patient engagement framework. One individual. This is a collective effort. And so it's been exciting to bring into the story and working alongside this individual, both a strategies tool from the Center for Implementation and the Involvement Matrix, and I'll pop those in the chat as well. Those have been just two of some great tools to help this individual understand, because now this individual, having talked more openly about their work around creating a patient engagement framework, has been asked by their local hospital to help them talk about patient engagement. They are just in the beginning of this journey. So I think that this is also a reminder of not only do we want to be certain of sharing and working together, but we want to also spread the word so that when a hospital goes to one individual and says, hey, we hear you're talking about patient engagement. Can you help us do some work around patient engagement? My fear is it gets watered down as well. And then some of us might feel like we just wonder, where do we start? And so I want to just highlight this importance around the community building and the intersection of bringing these pieces together of that trained experience and that learned experience. I'm going to pause there and pass it back to Vanessa, but I'll elaborate on it in future answers.
Beautiful. Before I continue, thank you. I see Kim, were you raising your hand there?
Oh, I was just gonna just a comment that sometimes you don't always know who the people you want to invite to the table are as well. Because I remember I was at like listening to a group talk about this asthma tool that they had developed, and I was like, oh, that's really cool. Like, were there any speech language pathologists involved in that? And they were like, well, why? And I'm like, well, I see kids with suspected asthma all the time. They've gone to the emergency room and they've been put on puffers and they've been given all these strategies. And actually, it's a vocal fold issue. And they have exercise-induced laryngeal obstruction. And and then they need to see a speech language pathologist. And they were like, oh, we hadn't even thought of that. So like how do you know you've got the right people at the table?
That's a great question. Thank you, Kim. And I just wanted to pause there if any of our panelists wanted to speak to that or how you've navigated some of those discussions and reflecting about who should be there and who's deciding that too, right?
I think that always needs to be a question that's top of mind, but some of that really does also come down to readiness and being mindful of that as well too. The idea that, and actually, what's interesting, a couple of our students from the training program recently created a whole app attuned to readiness as well too in that case, which is really neat. But I digress. I think that's kind of some of the things that we kind of naturally, impulsively go with the flow in terms of like, okay, if I plan a birthday party, I'm going to go immediately to the store and I just want, this, and this. But it's a bit slower to go like, hold on a second, maybe I should make a list. They always say don't go to the grocery store and grocery shop if you're hungry. Similar habits we need to adopt in kind of a bit of a slower pace in that case as well too, in terms of how thinking about who needs to be at the table, but then also not necessarily doing that alone, if you will. Sometimes that comes with us. I found one challenge sometimes with our learners with the family engagement program is the idea of a support community in this capacity is not top of radar. And I think everybody defines what that needs to be. People with lived experience have their own support communities as well too, in terms of navigating some of the challenges. But within like the research setting, are there people that you can connect with and just say, hey, I'm going to bounce some ideas off of you as well too? But even that, like a sustainable model for that in the past has been we have a group on Facebook and all of you are welcome to join. It's called Parents Partnering in Research. And it's just if you have just random thoughts about something you're strategizing, there are researchers and people with lived experience there, and they can just come and say, like, hey, I've got this question. What do you think about that? And people are just willingly giving up their answers in that case as well, too. So that has become a 10-year-long support community just to be someone that you can connect with and go, oh, you're on the right track and things like that.
Yeah, thanks for the question, Kim. And I can build off of Ray's great answer. I think it is about intentionality, right? Which I was speaking about before, and just thinking about, okay, who is at the table? Do we have the right, you know, that's loaded. Who is at the table? Who's missing from the table? And taking a pause before getting too far into the process to acknowledge who's not at the table, and can we do some outreach to reach those people. So just reflecting on one of our ongoing projects, and realizing that we didn't have any male youth as part of our panel, as part of as one of our partners. So did some work. We have a lead sort of youth representative who had done some outreach to see if we could recruit some male youth partners as part of the work. So I love what Ray, you were saying about sort of slowing down, and just especially when you're working in this context of a grant, and it's you've got limited time. You can feel the clock ticking kind of thing. But I think it is slowing down and saying, okay, we need to do this with intentionality, and if we want to do this more meaningfully.
Yeah, because it's more about who's not there than
Hmm.
is there. And yeah, I'm thinking
Yeah.
about Do we have everyone? And often you think, okay, these are the people we need to invite, but then, you're not slowing down and going, okay, well, who's not showing up and you know, who might have a interest or, might be affected by this. So, yeah.
Absolutely.
Beautiful. Thank you so much. That was a fabulous discussion to our first question, and thank you for your follow-up and an additional question there, Kim, too. And I was just thinking too about, even to that point, sometimes what we've done or what we think about is, as you're reflecting on, whose voices are missing and why that might be, is also building some of that outreach and engagement into your implementation plans as well, too, acknowledging you might not be able to do it all at once at the beginning, but how can you build that in intentionally as you learn moving through the implementation process too, right? Because sometimes we don't realize until we're halfway through the project and you're like, oh yeah, like those are important voices, like you shared the example with SLPs. I loved everyone's reflections, sharing on your own journeys, introduction into what implementation science is. And I'm hearing a lot of similarities too when we think about some of the barriers and facilitators to engagement in research more broadly, not necessarily implementation initiatives or studies, but how you can see that a lot of those barriers and facilitators and things and core principles are similar, kind of regardless of what you're doing and engaging in. As you were talking too, I was also thinking about even what you're implementing, right? And if you are truly doing that co-creation or engagement right from the beginning, what you're implementing would be informed by those individuals, whether that's family, community, organizations, versus kind of after the fact or designing your study with them and around that. Something I've been thinking about a lot recently too. And I will share some of my other thoughts and reflections as we wrap up. But I'm just thinking for the next question, I feel like you kind of touched a little bit on the similarities and differences as well between engagement science and implementation science as you talked through that first question. So I'm wondering if we want to actually move on and looking at the time to kind of the question about, one, your curiosities in this field, and thinking about what are important next steps that we can all think about, whether as researchers, as partners engaged in research, as implementation support specialists or practitioners, when we think about advancing engagement, both our efforts as well as the science in implementation studies, but also implementation practice, and thinking about how people can be engaged in actual implementation as well, in addition to the studying and of all of it as well too. And I'll put that in the chat.
Let's start. Oh, Sarah, do you want to start off? You're unmuted.
Go ahead, Andrea. Yeah, please.
Yeah, I think it's a great question, Vanessa. I've been thinking a lot more, and just like in preparing for this conversation today, it really drew my attention to that the similarities and differences and the opportunities for us to combine these fields. And because, I do implementation science research and I'm a patient-oriented researcher, but I don't actually do engagement science research that often. And it kind of showed me that that piece was missing to the work that we were doing. And so if in implementation, I think they've done a good, you have implementation practice. These are the tools and the strategies that you can use to try and mobilize evidence-based practice. And then implementation science is the studying of these tools and resources so that we can do a better job of doing it. And I would say that in our field of child health and disability, we're doing a really good job of engagement practice. Like you're seeing this huge increase in engagement and meaningful partnership, and we're developing, training programs and tools and resources to really support engagement practice. And then where is that field of engagement science that goes with it, where we're really studying how to do engagement better? And it is different than patient-oriented research, which is working in collaborations with patients to do research and meaning, and you may be evaluating your engagement, but not necessarily. And so I think personally, I've been reflecting on how could we embed, and as an implementation scientist, engagement is the core at what we do. Engagement can be applied across all types of research, from, clinical health services research, biomedical research, everywhere. There's always a role for engagement, but especially in implementation where we're trying to move innovations into practice, we need to be working in partnership. And so in implementation science and in this field, how can we do a better job of advancing engagement science at the same time? And it made me think about the hybrid trials and how we do hybrid implementation effectiveness trials. And there's different levels of these. And again, this is a lot of jargon, but where we evaluate the implementation strategies that we're doing at the same time as evaluating the impact or the effectiveness of the outcome. And in a way, could we add and do something similar where, an implementation engagement trial, I just made that up, but where we have these two core outcomes where we evaluate our implementation strategies, but we also, not just say engagement is important, but actually do something about it and say, we want to share what we're learning. We want to do better. And we're going to evaluate our engagement in that way. And, I think about, I shared as an example that, in the efforts, we've only recently started to do this, and we actually did build an engagement evaluation into one of our CIHR grants for another project called Envisage. But again, that was an example of the project that was the first piece when we were like going short for time and having to do so. That was the piece that was cut. We still did the engagement, but we stopped focusing on the engagement science piece of it. And so I guess that's where my hope is that we can relook at how we can put more focus on really evaluate and committing to evaluating our engagement practices, if we're saying that we want to do meaningful and authentic engagement. And it's not going to be easy because it's very hard to evaluate engagement, but that commitment's there, and so we start to explore that further.
Thanks, Andrea. I think coming from the lived experience side, that impact is always a part of the conversation for me personally, because I want to see things happen. I want to see things move. And sometimes that reality, I see that I've seen moments in the past where that's been frustrating for myself, but then I've also thought about that as with some of the families that I work with and mentor as well too, is that reality of things being bad on the ground and what that looks like. And so I think to tell, there are 2 points that I want to share. One of them is telling a realistic scope of the story of implementation, helping people better understand exactly where this fits, but also not only thinking about that, but what is a sustainable ecosystem for creating that change, where we understand where that there is that sense of belonging, that we are always a part of the conversation. We know where to go, we know who to connect with along the way. Um, uh, Seeing how we've kind of talked about impact in the past, like there's something kind of uniquely dissatisfying about seeing what can sometimes amount to backpats, like, look at this thing we made. It's a good job. We did a great job, but then it really doesn't go anywhere. I just putting a paper in the chat here as well too. This is a paper that I co-wrote with Dr. Katie Burney and Isabel Jordan, talking about the change in definition of pain through the IASP. And like, great, that's wonderful, but where is this going? Essentially, the theme of the paper was, so what? What's next? What is the plan in that case? And so to help people understand where they fit within this ecosystem and how they can be a part of that change becomes a part of that plan. And the fact that this is also very uniquely psychosocial work, that there needs to be people like myself in very similar positions to help move this forward, and ensuring that we're also mitigating the risk of harm along the way as well too. And so when we can see that very real change happen and working together, that to me is just a beautiful, hopeful future.
I can pop in next, and I really love this question, Vanessa. Yeah, similar to Andrea, and we have an ongoing grant together, and some cooking up some future plans in terms of this relationship between engagement and clinical outcomes. That is the hope. I think we often write about that of and hope that that's true, that high engagement leads to better clinical outcomes. And we need those validated tools to do that. So that's some of the work that we're doing together. I also think a lot about, like, stages of the research process, and what aspects, like, where and how we partner, and the in engagement, we think a lot about values and principles, and are there some values and principles that we need to prioritize at certain stages of the research process versus other values and principles at other stages. And I think that is perhaps through what we could track through measurement. Um, so those are some aspects that really excite me, and particularly when we're doing youth engagement, right? It's different work than partnering with adult partners. So how do we need to um, you know how do we need to change those tools, or for youth partners? What values and principles are important and meaningful to youth? Um, and the other thing I'll reflect on, and I think what engagement work has really my view at least, yeah, what engagement work has really highlighted in the implementation science world is that this changing behavior is relational, and I think all of us have touched on that in some form, and I'm really quite delighted to see there be an increasing focus on that. So people like Allison Metz and Annette Boaz are really doing some great work in the relational aspects of implementation, that I think it's really cool to think about. So and I think I would like to think are drawn from the engagement world, like we're talking about things like trust and power and reciprocity, and how all of that impacts implementation. And there's a paper that Allison Metz was part of, thinking about the different implementation strategies that we use, and which ones are relational, and which ones are more transactional, and which ones that are transactional could we make more relational. So those are some of the things um, I think about. And maybe just lastly, with all of us, thinking about learning health systems and, sort of rapid implementation, how do we do engagement work, which is, patients and families and other knowledge users are supposed to be, at the center of a knowledge learning health system. How do we do engagement work in sort of a rapid context? And I think that's where measuring engagement has a really important role. So lots to think about. No shortage of work. And I'll stop there. Yeah.
Yeah, I see Rachel with your hand up.
Vanessa, can I ask a question? Am I interrupting? I don't know if this will ring true for anyone else. I was really curious when I saw the title of the session, because for me, engagement is an integral part of implementation science. I don't see any way that we can implement new ideas without engagement, and really having a good understanding of the everyone that needs to do something different. So when I see these two things separated, I get a little bit concerned. and wonder if we're doing this for the sake of researchers, kind of building different pathways, or if there's a real reason for it. So I would throw that out to you as to why. Ray.
I think sometimes in processes, we think that people will naturally move towards like something like, yeah, that's just the way it is. But I think sometimes we need to actually like stop and take a few steps back and realize maybe people don't know the entire picture. And just kind of case example, I cannot begin to tell you how many times I've had this conversation with researchers and clinicians who have been astounded by the idea that a person with lived experience brings the good, the bad, and the ugly of their lived experience into partnerships. That to me, I thought would have been like kind of just assumed at that case, but the capacity of that, the weight of that, and how that impacts how you engage with somebody, is not always readily apparent. So sometimes the implicit isn't always as explicit as we would naturally hope it to be.
So are you suggesting we need to dive further into to understanding the engagement side of it to be able to really bring that into the implementation work?
I think to some degree, yeah, to be honest, because well, I mean, within the field that we work with, within, for example, within the disability community as well, too, there are implications in terms of how we how we do this work in ways that make sense, because that there is how we connect with people slowly. The notion of change is a very weighted one, especially now in today's polarized climate and things like that. And so, not only to think about having a voice and what that means, but like that to me, that's that uniquely psychosocial nature of that. And implementation is just that natural next step. In terms of being a part of that work, it's literally nothing about us without us in that case, but we also need to think about how to do that well and mindfully in some cases. So it's not always like something that rests in the researcher's side as well. It's also like there are clear implications in terms of how we do this, in ways that um, are meaningful and kind and supportive and don't do harm. In some cases as well too. So I think just there's a continued conversation that's very necessary is what I'm saying.
I'll pop in to Rachel. I totally agree. I mean, I see, and Ray, you said this too. Like I see the engagement piece is really the foundational piece, right? I don't see them as separate. I see I mean, it's of course my worldview, but my lens, but I think it's the bedrock of implementation. There's a, you know, design for dissemination, right? And this idea that we need to be, partnering with relevant knowledge users, right at the outset with implementation, in mind, and ideally right at the beginning. That's, to me, the ideal approach to our implementation work. Even, just referencing, the implementation strategies, right? And we have, um, of course, frameworks that we use, and taxonomies, and something I think about a lot is, well, we can match barriers and facilitators to implementation strategies, but what if you're in a low resource setting where you don't have, an opinion leader, right? That's where you're right. Just as one example, that's where you need, those partners to say, opinion leaders aren't going to work here, right? Here's other, more relevant, meaningful, implementation strategies that we can, um, you know, devise. And without those partnerships, you're doing that pairing. That pairing, seems, less meaningful. So, all to say, really, it was a point I meant to underscore, and I appreciate you bringing it up. Thank you.
Yeah, Vanessa, if you're going to respond, go for it.
Sorry, is that okay? I know I'm not technically a panelist.
Okay.
I was just thinking, and I think it's such a good point and question, Rachel, and I'm sure everyone on the call and why you're here today, right? Like this, obviously, that makes sense to you and it's foundational to everything you do and every aspect of whether it's implementation or any kind of research. But I think I'm sure we've all, come across people or situations where that doesn't come as naturally to people. And so for some people, it is helpful to think of engagement as a strategy. And I hope we move to a world where it's not, and it's just core and foundational to everything that we do. But I think for some people, they do need to think about it as a strategy to implement, or they need to think about the frameworks that support relationship building because it doesn't just come to the work that they do as naturally, which is fine, right? And everyone's at different journeys, and the importance of thinking about these things, I think, is what is most important. But that's sometimes how I like to think about it. And then, of course, even what's being implemented too. Sometimes it is still top down or researcher driven or whatever it is versus really being community led or community driven or organizational driven. And I think of, and I can put it in the chat, that like push-pull model that the Center for Implementation talks about in terms of implementation. If you're truly doing engagement, whatever it is being implemented will come from their needs and what they're telling you. Yeah, anyways, just random sporadic thoughts there.
Yeah, it's interesting that you talk about engagement maybe being a strategy for now so that it actually is maybe understood in some of this more procedural atmosphere. Because I think, sometimes when I do a lot of work in the with family engagement, but also I've done some work with children's treatment centers. So we're looking at health practice and health care and thinking about how surveys are like the number one tool for engagement. And I kind of cringe at that. I know a survey is a great way to get insight, but it feels so like it's like you're just soliciting insight, pulling, and not actually creating any sort of reciprocity or connection. And Ray's touched on some of this as well, because I think there's two words that come to mind in terms of the future for implementation science and engagement science. And the first word is sense making. And it was in one of the readings we did too around where sense making, the work of implementation science with engagement science is around sense making. We are trying to make sense, to create meaning out of an experience. And what does that look like? We need all of these voices participating and partnering in that work. I think also too about the word ownership. I did not go into the field of research when I started university. And what strikes me it just catches my attention every time I'm in a research environment that for someone to excel in the work of research, they need to publish, and get cited. And I remember speaking to a group of individuals last in November and just said, it's amazing that someone can be published countless times and cited countless times and never meet the individuals that the research impacts. I don't know very well the researchers that worked with my family and helping me understand my children. There's that disconnect, Rachel, is exactly what you're highlighting. And in order for anything to really come forward, I think we need to be really understanding how engagement science holds us accountable to that work and what actually happens moving forward into the future. Corey put it in the chat too, this idea around curiosity. Like when we lose that sense of being curious, we fall into our bias, we fall into our assumptions. And I think of like Jennifer Johannesson is another one I really appreciate. She and I chatted last week, and she has a pretty powerful address that really challenges some of the work around patient engagement, and perhaps the case for critical reflexivity, like just looking back at our work. Why are we doing what we're doing? And I mentioned earlier, patient engagement is a buzzword. Anybody and everybody is using it. What do we actually mean? What are we actually doing? And what is that engagement? I think too, Vanessa, you had talked at the top of the hour about a book that really has impacted some of your work. And I'll put one in the chat as well. And that's around confronting medical colonialism and thinking about, the voices that are missing, equity deserving groups in the conversation around engagement science. that is so necessary. And yet the reality is I find when I'm working, when I'm doing work around engagement, it's some of the same kinds of people coming forward who want to participate in the engagement work. And that's hard. That's really hard because we want to have all these voices that are willing to come forward, but we're missing a lot of other voices. And what's preventing them from coming forward? What's in the way? And I think those are really good questions to be asking ourselves moving forward is literally what's in the way. Elaine, I see your hand there too. I'm not sure if you want to contribute to this stream of consciousness. Pop off mute though, eh? Then we'll hear you.
You think I would know that by now.
All good.
Yeah, thanks so much, everybody. This has just been fascinating. And I love this last little bit of our conversation. I'm also from Holland Bloorview, and our team published a book just a few months ago called Coaching for Person-Centered Care, a solution-focused approach to collaborative care. And one section of that book is written by there are chapters by 3 parents and 2 young adults with disability. And really, despite having worked with those individuals for years, when I read their chapters during the process and before publication, and it's their experience in our healthcare system, generally speaking, typically, and their experience being able to reflect on what we call this paradigm shift of humanistic, collaborative, relationship-centered healthcare. And it really confirms, listening to this discussion, how what is required is a paradigm shift in terms of what we prioritize, in terms of our science is not culturally neutral. Like, that's the reality of it. And it requires an effort, a concentrated, dedicated effort to shifting our paradigms. What is it we want? And then what is it, what are the steps? And it's just fascinating to hear that this is, and I'm encouraged to hear this is so important to so many other people. And I think it's an idea whose time has come, and it's exciting to be part of this, given that, there are so many like such great work that can come out of, really making an effort to create a real paradigm shift in how healthcare is both provided and received. So my 2 cents.
Vanessa, before I pass it over to you, Elaine, I just want to respond to ask you if to invite you to put the name of the book in the chat. That would be really exciting to read that. But you've also made me think too about my own experience as a parent of 2 complex care kiddos in the children's treatment center world and the healthcare world, visiting the hospital. We're part of a pediatric palliative team. That sometimes this idea of family-centered service or family-centered delivery made me feel like we were the bullseye, and that people were just, that services and resources are being tossed at you and hoping something lands, that hits. And the reality is that paradigm shift, or I call it also a mind shift, is to think about how does that bullseye shift into something that is fluid and moving together. That there's this connection where there's engagement at the heart, rather than that family feeling like the bullseye, that the engagement allows for, some kind of understanding that will probably change over the course of the lifespan. But that engagement science actually helps us to really understand what we mean when we're trying to create some kind of delivery of services. So yeah, you just made me think of how, I often felt like the bullseye, and that did not feel like we felt like we were at the center, but the target, rather than being a partner of the delivery and of the resource and the experience. Vanessa, you're in charge now.
I see Ray's hands up. I just don't, if you want to say anything there quickly, Ray.
Oh, sure, absolutely. I just want to say, Elaine, I really appreciate the fact that you brought the weight of the conversation to what we're talking about here today, because I think that really matters. In a short version of something I did a number of years ago, this was kind of like mid-COVID. We were doing the next phase in the reporting cycle for the UN's Convention on the Rights of Children. And it wasn't me out in Geneva, wearing fancy clothes. It was me in my living room with my laptop sitting on a 24 pack of toilet paper while my spouse walked by in his robe. That's just kind of the reality upon which we were switching ourselves around at that time. But at that point is with you had government constraint and you had 30 people from Canada representing Canada who had half an hour to share in that conversation. And what is so brilliant in that moment was that we had a WhatsApp chat going on, and it was this elaborate dance of, okay, so and so, you take this question, so and so, you take this question, so and so, you're really good at this question. I don't need this one, you take it, you're better at this one. And in that, I think what was so beautiful in a moment like that was that people took the time to be heard, understood, and amplify people. And I think that there are numerous conversations, and some of them are very uncomfortable in terms of how, as we build this ecosystem, there the cultures that need to have awkward questions about even still, like I would be considered in the system a super user, but in some cases, I know ethically speaking, I've had to step away because it's not right to have me in that conversation. Like there's a million and other different conversations to be had here. But I think what you brought to this is that I think we can all collectively begin to do this dance, and we need to recognize it for what it is and how beautiful it is when we design it together and make it happen.
I love that. We could just close right there, Ray. That was beautiful. Thank you so much, everyone. That hour and a half flew by. I'm just being cognizant of the time and also wanting to give an opportunity for any final questions, comments, final comments from our panelists, any questions from the audience. I did pop, sorry, speaking of surveys and how they can be problematic. But did pop a survey in the chat. If you have a chance, it should be about 5-10 minutes max to share some feedback on today's session. I'm also going to save the chat, and I know there's a lot of beautiful comments and reflections that have been shared throughout this hour and a half together, so I will save that as well. Feel free to also send us an email. If you have our emails, I can put my email in the chat. Many ways to share your feedback, so we really, really appreciate it. I can just, share from my perspective. I really appreciate, thank you again to our wonderful panelists for coming, taking the time to share your journeys, your experiences, answering and asking hard questions. Rachel, I love your question and how much discussion and reflection that generated. I think through this, we can all agree on that relationships and engagement are foundational and central to everything that we do, including implementation and advocating and working towards that paradigm shift within our systems so that we can truly co-design and co-lead everything together and make meaningful and impactful change. This session is recorded. We are working on getting this shared on the Kids Brain Health Network webpage. I would like to also just give a shout out to KBHN for supporting, leading, being so open in how these sessions are designed and framed. So thank you so much. And Corey, I see you unmuted there. And then if there's any other questions or comments.
Well, I just wanted to echo everything Vanessa said. A huge thank you to Andrea, Ray, Sarah, and everybody who asked questions. I also wanted to say a huge thank you to Vanessa, who's just done a fantastic job putting this together. It was amazing to see. We got up to 60 people on the call at one point. And my kind of reflection and takeaway goes back to something that Brian Goldman wrote in his book on teamwork, which is, we all have skin in the game. And I see that from the researchers, I see that in the clinicians, I see that with family members, and I see that with the youth themselves that we're supporting. And I just think that I could not be more excited in the way in which I see a future where engagement and implementation really are going to be co-elevated together in really meaningful ways. So just thank you to everybody here. Really excited for the next session. And again, a huge thank you to the panelists, those who asked questions, and Vanessa for putting this all together.
Thanks so much,